The following program has been furnished and paid for by the Health and Wealth Power Hour, and KSCB is not responsible for its content or the product or services offered.
Welcome to the Health and Wealth Power Hour with industry expert and health insurance broker pro, Harlon Pickett. A show about how you can live longer with more cash and flexibility to really enjoy those years and never run out of money. Harlon will take your calls on a variety of topics related to health insurance, health care, retirement income planning, Social Security, thrift savings plan, 403B, 401k, or just about anything that gives you the tools to take action on keeping more dollars in your pocket and putting more dollars towards your retirement. He'll even share a few industry secrets if you listen close. And now, here's your host, Harlon Pickett.
All right. Welcome aboard Health and Wealth Power Hour. It is great to be with you today. Man, this cool weather is really nice. Got everyone moving a little bit, keeping the blood pressure going, keeping the blood flowing. It's just a great time of year. I was walking around outside this morning and said, man, it'd have been a great day to be on a deer stand. But it's open enrollment, ladies and gentlemen, and therefore I was not sitting on a deer stand. Instead, I was helping people get their health insurance taken care of because that's what I do. It, of course, also is right in the middle of annual enrollment for Medicare. So we got a lot going on. In fact, if you work for a company, you probably are in open enrollment yourself for your company, or it's just passed. It may be coming up if you're, depending on what the situation is. A lot of them like to get it taken care of right now. It's one of those situations this time of year when you've got folks that are just so busy that I think a lot of times you yourself, if you're shopping for insurance, you just decide, I'm going to handle it because I think the folks that do this for a living are just so busy that there's no way they'll be able to take the time to help me. Well, I'm going to highly recommend that you don't do that you do reach out to someone for help. Obviously, I'd love for you to reach out to us here at Eagle Care Health Solutions and let us be the ones to help you. But there has never been a year when things weren't more confusing or difficult to just look at all the options. And the reason for that is because of all these additional companies that came in. And then what the response of some of the companies that have been in the marketplace have done. And an example of that is a couple that I was looking at their situation. The gentleman has a benefit plan through work, but they were looking to see what their options would be if they could look at the marketplace. Because of how much they pay for their plan, they were right there at the point where it would be considered unaffordable, and therefore they could potentially get a tax credit and look at some of the other options. They had some very specific needs, however, including a doctor they wanted on the plan and a pretty expensive medication they wanted to be sure was covered. So as we went through and looked at the situation, they happened to be in Brazoria County. And being familiar with Brazoria County and the plans that were there, I was not prepared for what I saw. Because traditionally, and when I say traditionally, I mean since the ACA has started over the last few years, including just a couple of years ago, there was only a couple of companies that had plans there, and that was Blue Cross Blue Shield and Ambetter. And they had a total between the two of them about 16 to 20 plans, somewhere around that area. Well, when I looked for these plans for these individuals, there were 254 options available in Brazoria County for 2022. 254. Now, I am a seasoned veteran of this market and a seasoned veteran of selling ACA plans. And I have never in my life seen so many options available in one county. Now, Harris County and Bexar County and Tarrant County and a number of places like that have even more. But the fact that Brazoria County had 254 options was just unbelievable to me. That is what we see typically when we're looking for group insurance for somebody. If I'm looking for traditional group plans, that is the number of group plans that show up because they're just very small differences in those plans. And if that's the case, Humana may have 50, 60 plans available in a certain area. with all of them having some small changes. Obviously, when you get all the way across the board, one's going to have, say, a $7,000 HMO, and you're going to get all the way to the $500 or even zero deductible PPO, and then there's everything in between. So they have all different iterations of that to get you to that point. And why they do that, I think that's a lot of that's about confusion too, but that doesn't make any difference. They're there, so you have to have someone help you figure out what's right. Well, at the end of the day, as crazy as it sounds, out of 254 options, my recommendation was for them to stay with his group health plan. And the reason for that was because none of those plans were accepted. None of the 254 plans were accepted by his doctor. And even though there were some that covered at a level the medication, they weren't enough to offset the fact of what they would have to pay to go and see that doctor. It just didn't make sense. The bottom line is they would have never known what to do to even look at that information. They may have said, hey, look, wow, here's an Aetna plan. Aetna's a good company. Let's go ahead and sign up for that plan. Without knowing how to look and see if the medication was covered or looking to see if their doctor could accept it, and just made that change on their own without making sure that it was truly a good option for them. Will always help you look for these plans at no cost. And of course, we really want folks to join our movement and get away from the ACA plans, get away from that and stop feeding the churn that is the insurance companies just putting us through the shredder. Because with the Eagle Care Health Solutions plans, the plans that we created for you, those plans do that. We have pushed health insurance to the side, and we said, you know what, let's have true, real access to health care instead of having to go through an insurance company that certainly is not after your best interest. They're after their own best interest. They're a money-making machine. If you will take that jump, then you can get much better options and much better access. But I know a lot of folks still think that health insurance is the only viable solution for them. And, you know, depending on what your situation is, I may have to agree with you in some instances. But it doesn't hurt to check, and we're always going to give you the honest answer. You certainly can reach out to us anytime at our 24/7 phone number of 512-559-4358. That's 512-559-4358, or eaglecarehealth.com. That's eaglecarehealth.com. You can look at our solutions. You can, of course, go on and look at ACA plans there. You can even run some quotes yourself. But most importantly, you can get right on there and set up a 15-minute consultation with one of our awesome agents to go through and look at all of your options to make sure that you are getting the best plan possible. As we go through today, we're going to talk a lot about what's going on in the market, a lot of what's going on the Medicare side of it too. There's just so many changes and so many things you guys need to know about and understand of what's happening out there with the mandate coming up as far as you having to be vaccinated. We're going to talk some about that today and how that's going to change the industry itself. And, of course, one of the things that's happened on the life insurance side, how are we going to see this change? And that is, after last year, we've had a dramatic change in life expectancy in the United States. And how are insurance companies, life insurance companies in particular, going to adjust for that? We'll talk about all this and more when we get back from the break. Harlon Pickett, Health and Wealth Power Hour. We'll be right back.
Whether you're an individual or a business owner, Eagle Care offers health plan payments around half of what most are paying in traditional insurance premium plans. Plus, you'll have the control to choose providers from one of the best provider networks in the nation.
During COVID, we had great coverage for our whole family. The day I signed up, we had a welcome call, and it was so personal and genuine. Plus, we went from $1,500 to $690 a month with Eagle Care. Thanks.
That is the Eagle Care way. Reclaim your freedom to choose and soar high above the rest. Find us online at eaglecarehealth.com. Eagle Care Health Solutions. It's not insurance, it's better.
Catch Chris X Radio weekdays at 4, right here on AM 700 KSEV.
When stumping in Virginia for Terry McAuliffe, Sleepy Joe really drives the point home.
We're taking a page from Terry's book when he was governor and when he'd be governor next time. We're emerging from this pandemic. We want to expand pre-K for 3- and 4-year-olds, millions of pre-K students.
He's getting so much better.
Chris X Radio, weekdays 4 till 6, right here on the Voice of Texas. Want to be part of the conversation? Phone lines are open. Call now, 281-558-5738. That's 281-558-KSEV.
This is Harlon Pickett for Eagle Care Health Solutions. Because of the American Rescue Plan, you may qualify for reduced health insurance costs or even a zero premium. Let us help you secure your savings by taking action now. Just contact us here at Eagle Care Health Solutions, online at eaglecarehealth.com. We know getting good, affordable coverage is hard. Eagle Care makes it easy.
Don't miss your chance to reduce your health insurance payment. Government estimates $50 per person per month savings. Go to eaglecarehealth.com.
Oh, yeah. That's a good one there. Harlon Pickett, Health and Wealth Power Hour. We are back with you. I have been helping folks figure out their Medicare options for a number of years now. And one of the biggest questions that we get is, what is the difference between a Medicare supplement plan, such as a Plan F, Plan G, Plan N? Those plans work with Medicare, and the fact that they kind of cover the parts that Medicare doesn't. Medicare is basically an 80-20 plan, and then you get a Medicare supplement to cover the part that they don't. What they don't have is any prescription drug coverage. They do not have prescription drug coverage. That is a separate plan then, typically called Part D, or standalone prescription drug plan, or a PDP. The important thing to find out whenever you look for one of those is you want to make sure, of course, that it's, I know this sounds crazy, but that it covers your medications. Now, if you're turning 65 or maybe this is the first time ever that you need to have a prescription drug plan simply because you've had it through work. Maybe you're retiring now. So whatever your situation is, you're going to need a Part D or a PDP for the first time. The reason it's important to get that plan when it's first eligible for you, when you're first eligible for Medicare, is because if you don't do it then and you get one later, then you would have to pay a penalty. So, yeah, exactly. Listen to me for a second here. If you don't get a plan, if you don't get a Part D, when you first are eligible to do so, and you wait till later, then you would have to pay a penalty to do that. Now, the exemptions to that is if you have a group plan. If you have that group plan and it has a qualified prescription drug coverage with it, which most group plans are going to, then you're fine. Once you leave that plan, then you would need to get one, but you would not have that held against you. So even if you don't have a medication that you need to have covered, there's been a couple of reasons why I've had people tell me this, why I don't take any medications, or maybe I take something that's only costs $3 or $4 or less because it's a real low-level generic medication. Well, why would I want to get one of those? Well, first of all, you can find some that are less than $10. So that's a good deal right there. And you never know when something may happen that you would need a medication that might not be very inexpensive, but your drug plan may help you with those costs. But the biggest part of it is because you don't want to have to pay that penalty, because that penalty is there for forever. So if you were to wait, it's 1% for every month you didn't sign up. So that means if you were to wait a year, you'd be paying a 12% higher premium based on the average cost of the Part D plans across the country. You'd be paying a 12% higher premium than everybody else. And that would last for the rest of your life. And it would also go on whichever plan you switched across the years. It would work on that. It would apply to that. So you want to make sure you had all three parts of that. You had your Part A and Part B. You had your Medicare supplement. And then you also had a standalone prescription drug plan, also known as Part D. Now, the other side of the coin, which a lot of people like to go with, is a Medicare Advantage plan, also known as Part C. Now, Medicare Advantage plans can be without prescription drugs or they can be with prescription drugs. So you have your MAs or Medicare Advantage, and then you have your MAPDs, which is Medicare Advantage prescription drug plans. And those are the plans, the Medicare Advantage prescription drug plans are the most popular plans, obviously, because they're kind of all in one. They work more like a traditional plan that you had when you were working, or even if you have an Obamacare plan, they work more like that. And the fact that you're paying, one premium, in this case you're paying for your Part B, but you may be paying a premium or maybe zero. There's tons and tons of zero premium plans out there, but it's coming directly out of your Social Security. So in essence, it feels like you're paying just one premium, because if you're paying Social Security and this year you're paying that $148.50, and if your plan was say $10, then what you're really paying is $158.50, but all of it is taken care of in your Social Security. There's other ways to pay if you're not taking Social Security, but we won't cover that right now. What you're really getting, though, is you're getting co-pays for all your different services, and of course your prescription drugs are built into it also. Though there are HMO versions of that, there are PPO versions of that. The biggest thing that you need to look for, once again, is how are your prescriptions covered with that. Each of the providers of those allow you to enter in prescriptions to check that out, and also you can look at your doctors. Those, of course, are the two biggest issues that you're faced there. Other things you want to look at on those plans is what your max out-of-pocket would be if something terrible were to happen, and also what your copays would be for things like specialists, for hospital stays, for inpatient and outpatient services, MRIs, and many of those plans also include things like dental and vision. So you can look at all the different benefits that you get on there and decide if that's a better way for you to go too. Now, why many, many people like to go with a Medicare supplement is because there is not a network involved there. You can go anywhere in the United States that the doctor accepts Medicare, which is really cool. People love that. Wow, what freedom that is. You can go anywhere. Lots of people, lots of hospitals, lots of facilities, lots of doctors, urgent cares, whatever that is, all across the country are going to be accepting Medicare, so you have a lot of freedom whenever you go with that option. For someone who plans on traveling into retirement, then that is an excellent, excellent option. The downside of it, of course, can be the cost, because those plans do give you more freedom because there's not networks, and really there's not a lot of waiting periods. If you need to have something done, then you just have it done. You're not going to have to worry about getting that approval. Because of that, the costs are going to be a little bit higher on that, and they're going to go up over time. So if you were to sign up, say, for $115 whenever you're 65, there's a good chance that that's going to be in the $150 range by the time you're 70, 72. There's a good chance that's going to be over $200 by the time that you're 80. What will your budget allow at that time? We do see that. We see people that get into the ages where you would think they're going to need this type of plan even more because of the restriction of how much cost they're going to have. Obviously, you got Medicare covering part of it. You've got your supplement covering pretty much the rest of it. If you have a Plan G, you got a $200 deductible or $203 deductible this year. Other than that, everything's covered. Your bill's on $500,000. Well, you pay $203. That's a great thing. People love that. But how much can you afford to have those benefits? Once you get to a higher age, it can be extremely expensive. So while that is really the option that I recommend to most people if they can afford it, it can also be very cost prohibitive in the future. Whereas you have your Medicare Advantage plans that really it's a different way. You're not paying anything, or you're paying very little up front, but you've got the cost on the other side. You have co-pays, you have other things there. Now, when you look at both of these options, remember the biggest part that you have to look at is your prescription drugs, because in both directions that you go here, it's going to be your prescription drugs that are probably cost-wise the driver of what it's going to be. What's it going to work for me? Because even if you're looking at a Medicare Advantage plan, if you have a PPO, most of the time you're going to be able to see your doctor even if your doctor is not in network. You may pay a little bit more for that, but your prescription drugs could very well be the deciding factor in whether or not that plan is going to work for you. It's a big deal. And we're talking about thousands and thousands of dollars differences in plans. One of the gentlemen I was sitting down with this week, unfortunately, he takes 17 different medications. But as you go through and put all those medications in and look at what the cost is going to be for him, the differences were, I think on the low end, we were at about $3,500 a year. His annual cost was going to be about $3,500 a year on the plan we ended up getting him set up with. But it didn't take us very long. On page, I think, two or three of the options that were available, of the 72 options that were available in Bexar County, of those options, on page 2 or 3, we had already got up to $10,000 a year. And if you kept going, we got all the way up to $37,000 a year for his medications. So can you imagine someone who just is in love with a certain name company or watched a commercial on TV and let that be the deciding factor on what they did to sign up for a plan? And all they did was call up or even get online and go through and sign up for a plan, and then found out come January that their medications were going to cost them $5,000 this month. Yeah, that'd be quite the eye-opener, wouldn't it? It's very important to talk to someone to get the help to make sure that you're in the right plan. That's what we do. Don't hesitate to reach out to us. Our services never cost you a penny. 512-559-4358, EagleCareHealth.com. EagleCareHealth.com. We want to save you money. We want to make sure you're in the right plan. We want to make sure you have options too. And we're going to look through, we're going to explain how all this stuff works to you and make sure that you have the very best plan. One other thing I want to talk about on your Medicare supplements in particular, there are various different ones. We mentioned earlier Plan F, Plan G, Plan N. There's other options in there too. The Plan F is not available any longer to anyone that turned 65 in the year 2020 or later, but the only difference between it and Plan G is in Plan G you have to pay your Part B deductible, which, as I mentioned earlier, this year is only $203. But the difference in cost from these two plans is quite a bit. So someone who may even qualify because they did turn 65 and got on Medicare a number of years ago, maybe they've been on a work plan, when you're looking at these options, know that Plan G is probably a better option for you because the cost of Plan F is going to be significantly higher, and that plan is going to go up faster in cost over the years than a Plan G, because since we're not selling any new ones of those, or not very many of them anyway, that pool of people is going to get smaller and smaller faster, and therefore the cost is going to go up. Just to change that, insurance companies, to level that out, insurance companies are going to have to raise that cost to make it where it's a viable product for them. All right, when we come back, we are going to talk about what the impact of some of these things are going to be, the mandate, also the new change, or the change that has just been released in the life expectancy. We'll talk about those and what their impacts are going to be in the industry. Harlon Pickett, Health and Wealth Power Hour. Be right back.
Got FESA? That's the Federal Employee Service Association. Find out what FESA can do for you. A recent client had this to say.
Joy took what felt like a 12-lane highway heading off in all different directions, and it turned into a single-lane country road. Feels like my first breath of retirement, and it feels good.
This is Harlon Pickett. My friends at FESA believe in the old saying, what goes around comes around. By helping people at no cost to them, many times they can retire earlier than expected with an income they cannot outlive. Go FESA at gofesa.com. We help Americans retire.
Paul Berlin, a radio icon. His unique style and warm personality endeared him to so many. His endless stories and great music will never die. Paul may no longer be with us, but his memory will live on. KSEV is proud to continue with the best of Paul every Saturday evening, 6 to 8 p.m. Paul said it best as he closed his show.
We'll meet again at 700 AM KSEV in Heavenly Houston.
Got a question for Harlan? Phone lines are open now. Call 281-558-5738. That's 281-558-KSEV.
This is Harlon Pickett for Eagle Care Health Solutions. Because of the American Rescue Plan, you may qualify for reduced health insurance costs or even a zero premium. Let us help you secure your savings by taking action now. Just contact us here at Eagle Care Health Solutions, online at eaglecarehealth.com. We know getting good, affordable coverage is hard. Eagle Care makes it easy.
Don't miss your chance to reduce your health insurance payment. Government estimates $50 per person per month savings. Go to eaglecarehealth.com.
Oh, yeah. Harlon Pickett, Health and Wealth Power. We are back at you. Wow. U.S. recorded steep decline in life expectancy last year. Wonder what could have caused that. Yeah. The life expectancy declined by almost 2.3 years for U.S. men and more than 1.6 years for women. Obviously, this is a direct result of the pandemic. It didn't stop other more, let's call them what they are, more serious situations such as heart disease, which is still our leading cause of death. But it certainly added a whole lot more to it. Now, is this just a bump in the road? Is this just an anomaly? Will we see 2021, we've obviously still seen a number of deaths from COVID, certainly not near as many as we saw in 2020. So as this steadies, as the boat kind of comes to a steady, what's going to happen? What are life insurance companies going to do about this? What are life insurance companies going to do with COVID-19 in general? How are they going to rate people now that have had the disease? How are they going to rate people that have had the vaccination or have not had the vaccination? Is there going to be a question about that? This is a huge, huge issue right now in the life insurance industry. And as you can imagine, it has been kicked around quite a bit. I don't think that a consensus has been reached, certainly industry-wide, but we are certainly seeing rumblings and seen some emails and certainly heard some people talking in different events that I've been to that it's going to be there. There's going to be questions regarding COVID-19, and the questions will in summary sound like this: Have you had COVID-19? When did you have COVID-19? What was your recovery from it, and are you having any lingering effects from it? We all know that it has been a very different, wide range of situations. I've known people that had it, and you could never tell they ever had it when they had it or since then. I've also known people that had it and barely had any reaction to it when they've had it and have had just terrible times since they have had it. Not been the same at all. I've known folks that had it and had a tough time with it, and you can't tell that they have anything going on since they've had it, and then the other. They had a terrible time with it and have had a terrible time since then. So it's a very interesting situation. It's a very challenging situation for obviously not just doctors, but for anyone that is out there having to really look at this and deal with this and say, how are we going to deal with this in the future? So I'm not envious at all of the folks that have to make these decisions, the actuaries and underwriters. I'm not envious at all of what their situation is here. Looks like we have a caller. Hey, Emily.
Hi, Harlan.
Welcome aboard. How can we help you today, ma'am?
I had one question about plans and then another question that's more like a legal or political one about the ACA, that they changed the law, so it's no longer applies. So that's the question about that. But can I ask you the health question first, and if there's time, I wanted to ask your opinion on the other question I had about the ACA. Okay,
Sure.
so when the ACA was in effect, I signed up for health shares, and the cheapest one I found was, I think, Christian Health Share Ministry was like $45 a month, but it had a huge deductible, and I just did it because I was never going to use it. I just needed to be legal. So
Sure,
I paid
I understand.
$45 a month. Now, I found since then there's a nonprofit cooperative in Houston. It's tbt.org, or Patient Doctor Medical Plan. And they said if I still wanted to pay for like just the basic rate where I don't plan to get the insurance, they offer insurance and they also offer catastrophic with no deductibles, but it's more expensive. It's like half the cost of a group plan, but I still can't afford that. So I would still want to go with a kind of a health share program, and I prefer local. Like if I can buy from you and you're a local business, I think it's better to invest locally rather than a group. So they said that they could kind of combine the two, that if I go with your the kind of health sharing that you do, where you share the cost, it's not insurance, but you kind of share the cost. I understand the concept.
Right.
They could still apply their cooperative part to some of that, where they cover, have you worked with cooperatives before where they apply their system to part of it and let the health share part cover the cost? I would still get discounts through the cooperative, and then because I'm part of a health share, then whatever discounted cost I have, that's where I end up getting distributed, so it costs me less. Have you
absolutely.
combined with cooperatives? Do you know other
Yeah.
cooperatives in Houston that I could compare and see which one is the best cooperative? Do you know some other ones?
Absolutely. We could certainly get together after this. We can have a conversation once again, Emily, and talk about how we work with those. But
okay.
A health share, and I'm not going to say all of them are like this, but in our health shares, you do not have to use any type of network. As long as you're getting your services, let's just say, as long as you're getting your services from a qualified medical facility, even if it's out of the country. I know that sounds crazy, but let's just say that you found a doctor in Spain that did a surgery and he was well renowned for that, and that's where you wanted to go. We would still share that cost.
Right, but do you negotiate it? What the cooperative does
Absolutely.
Negotiates them down to Medicare pricing. They can go in and
yes.
encourage and get agreements from hospitals and whoever it is that you go to. They can generally get them to agree to pay Medicare pricing because they get paid right away.
Yes, absolutely.
So you do the same thing? You do that also?
We do the same thing. Yeah, we do that same exact thing, and we are fine with working with co-ops to do that too. So once again, we can talk about those different situations. We have doctors, we have direct primary care doctors we work with to provide kind of the catastrophic coverage, I guess you can say, for their things, the sharing side, because a DPC does some great things, but if somebody needs to be hospitalized because their gallbladder's gone south on them, there's nothing they can do on that side. So we work with them.
I'd love to see if we could partner up, because I'd like to promote different plans like you. I believe in getting people off the government stuff, learn to do it yourself, and it saves the nonprofit calculated how much money you generate when you do your own health care. It's just amazing the millions of dollars that you would be in control of if you quit thinking that the government can do a better job than you can.
Absolutely. I agree with you 100%. That is part of the revolution that I'm a big part of. That's why we talk about going to these free market surgery centers, whether it's the ones here in Texas, the ones in Oklahoma, that are going to give you just that flat cash rate. They don't even deal with insurance because they understand that that's really the problem. Of course, what we see, Emily, is folks that really have no choice. I mean, you're going to have people that are in a financial situation or in a medical situation where they have pre-existing conditions that they're not going to have a lot of options, unfortunately, right now. And so there's a place for the ACA, but if I could make it all go away,
on that note,
I would.
That's where I would like to bring up my legal argument and see if we could stop any more of this kind of nonsense. My argument, when they first came out with the ACA, and I looked at the exemptions, they were basically, the federal government was not only requiring you to join a religious nonprofit and pay, but it had to be a certain type. There were certain groups they regulated that counted and something that didn't. And I said, is this not regulating and discriminating on the basis of religion? It's making you pay to join a group in order not to be punished. I mean,
right.
I saw that, and I wrote to my legislators, I wrote to people, and nobody seemed to carry the argument. All they wanted to do, when I talked to my Republican conservative friends who are against the ACA, they thought that if you fight the battle, you're going to get sucked up in it. They're going to badmouth you and make it your problem. If you touch the ACA and it doesn't work, it's going to become your fault. So they were going to do it by not touching it and just run a campaign, and that's how we got Trump elected, because there was nobody willing to just like and got these people in. They used that to kind of like cut the whole thing off, where we're not even going to touch the unclean thing that is totally unconstitutional. We're not even going to argue that. And I felt like we should have argued. We should be teaching this is not even constitutional to begin with. Don't try this again. You should pay the difference. You should pay the cost. Whoever passed this, the half of Congress who signed on to something that is against the Constitution, you should have to pay the full cost of what you did and pay the restitution, and you pay for your own party, and you pay for this mess that you created. So that's my argument, and I can't find people willing to go there. They all want to avoid the whole thing and just vote people out of office completely. And I'm saying, why don't we go in and point out which things were totally wrong and teach them you cannot do things like this in public policy. You can do it within your own party, your own religion. You can pass whatever you want about health care as a right. That's a belief. But you cannot go and force people to pay for your belief. I mean, what does it take to establish that? Because I think that would stop this practice altogether and make it where you can only do it in private. Once we agree, that is not constitutional for public policy. And just make it clear. How hard is that?
I understand. The problem that has happened is every time it's been challenged is that side hasn't won. I mean, as you know, it's went all the way to the Supreme Court, and either they have refused to listen to it or said there was just no standing for them to listen to it. They don't want any part of it. I think that they understand that it's not constitutional, but if they can find a reason not to even have it brought to them, which that's what they've done in the past, then that's where you're going to go. I agree with you too that it should have never been mandated, but once it was mandated, once that happened, so a little bit about who they got to decide. The reason that they chose the companies or the health shares is because they said they had to have been in business for so long. They had to have been established for a certain amount of time. Well, that left only a few that were there that could follow that. And because it had traditionally been a Christian health share type business, none of the new health shares that were developed after that qualified for that. And I think that's why you've seen so many health shares come about since the end of the mandate, because they realize it is a great idea. And there's a lot of people that are interested in getting away from the ACA. But now that the mandate's gone, that opens up the door. One of the things a lot of people didn't understand is that really at the end of the day, the penalty was not too bad. You would have still been better off in many cases going ahead and getting on your health share and paying the penalty than you would have been trying to get on an ACA plan, especially because of the high cost if you made very much money. But it was just an interesting concept that, there's that penalty, there's those taxes, there's going to all these things that are happening. Well, that scares people. And while I agree with you, Emily, that it should have never been there, it's unfortunate that we've got what we got. But, in my business, we tell people, hey, I'm going to help you in whichever way I can, in the very best way that I can. And if what that means in this time of your life that you need is an ACA plan, well, it's unfortunate that's the system we got, but that's what I'm going to help you get. And that's kind of the view that I look at, is I'm just going to help everybody the best way that I can with whatever the system is. I'm going to work to get rid of that system. I'm going to work to put out a better system. But, in those first 2 years when Trump was in office, the Republicans had a prime opportunity to make those changes, and they failed to do so. They failed us in that time whenever we had the House and we had the Senate and we had the president on the Republican side that were against this, and they failed to do anything. And that was very disappointing too.
Well, I agree with you that there's I think we're saying the same thing. And the law, what bothered me is it actually said in there that you needed to be part of a religious certain religious. It's like you're already regulating religion as a way, So it did not state, just because of the time frame. It actually said religious based. It had to be a faith-based group, and it had to be a certain type that was approved. But anyway, I do.
The
one
reason
friend
that
who
it said
explained to me what.
Yeah, the reason that it was that way is because they knew that's the only ones that qualified. So they kind of trapped you into it.
That was regulating religion on the basis of religion. But the one friend who explained to me why the Republicans could not touch that thing is politically you would get blamed. If anything, you changed anything, then they would turn it against you and use it politically. They had to not touch it. Just like you're saying, the courts really can't rule one way or the other. So that's what I believe. It's because it's a faith-based belief, believing that health care is a right, and it trumps the involuntary servitude it would cause or whatever. If that is your belief, people have a right to it. You have a right to exercise your belief. The crazy thing about this belief is it's a political one. It involves the government. So there is nothing in the Constitution that explains how do we deal with political beliefs. It says free exercise of religion. It says you cannot establish religion. The civil rights tell us we can't discriminate by creed, but it doesn't explain, well, what do you do? What happens when someone's belief inherently involves government? How can you have it both ways? How can you let someone exercise their belief and also not impose it on other people? So that's where I believe what we're heading toward, and I hope Texas will be an example. And I really, you inspire me to really work with you about how we can get Texas companies involved and really make it Texas-owned. I think your approach is the way we can do this. But what I think is going to happen is healthcare is going to have to be controlled by the parties, because parties can organize their members by belief systems. That's perfectly legal to do it that way and pay the benefits under your own mandates for your members. So we can preserve both the political belief and the freedom of other people if we can somehow switch it where the parties govern the terms of the membership and the taxes and things where the members agree to them. It's still religion, it's still your faith, but it's private, sort of like the Catholic Church can have its pro-life policies for its members and not bother other people that have a different policy. So that's where I think we're headed, and I certainly will contact you. I want to, I got your information down, your website and your phone number.
Yeah.
And I will contact you because this is not just, me personally about benefits. I see a bigger issue that if I can solve it for myself, we can ask all parties to do it for their precincts and solve it for their communities. So I'm in it for the bigger plan, and it sounds like you are too. So if we can work together, I would love to do that and present something to the state governors about how to solve this problem.
That sounds great, Emily. I sure appreciate it. We have been also talking to Ted Cruz, and I think that he may be on the show here in the next few weeks also. He agrees with us on a lot of things we talked about. I sure appreciate you calling in today. It is time for a break. I look forward to you giving me a shout, Emily, and we will discuss this some more. Harlon Pickett, Health and Wealth Power Hour. We'll be right back.
Got FESA? That is the Federal Employees Service Association, and they've been assisting federal employees and the private sector with their retirement benefits for more than a decade, helping you understand your benefits, ensuring that you are not paying for benefits you don't need, and that you will receive the largest retirement check while paying the least in taxes. That's what FESA can do for you. A recent client had this to say.
Joy took what felt like a 12-lane highway heading off in all different directions, and it turned into a single-lane country road. Feels like my first breath of retirement, and it feels good.
This is Harlon Pickett. My friends at FESA believe in the old saying, what goes around comes around. By helping people at no cost to them, many times they can retire earlier than expected with an income they cannot outlive. Go FESA at gofesa.com. We help Americans retire.
Want to be part of the conversation? Phone lines are open. Call now, 281-558-5738. That's 281-558-KSEV.
This is Harlon Pickett. My friends at FESA believe in the old saying, what goes around comes around. By helping people at no cost to them, many times they can retire earlier than expected with an income they cannot outlive. Go FESA at gofesa.com. We help Americans retire.
Money Matters with Steve Drake.
Hey, Dennis. Hi, welcome to KSCV. Good morning.
Hey, I listen to a lot of talk shows all over the AM stations, and I wanted you to know that you are by far the most creative, informative talk show I listen to. I'm one of your 100 very loyal
Oh, my
listeners.
gosh. That's so nice. I'm honored you listen, and I'm flattered by your compliment. Thank you.
Weekdays 11 till noon on AM 700 KSEV.
Eagle Care health plan options are about half of what most are paying for a traditional insurance premium plan. Plus, having control to choose providers and real help getting your health needs met at the most optimum outcome.
Reclaim your freedom to choose. Soar high with Eagle Care. Find us online at eaglecarehealth.com.
And we are back. Harlon Pickett, Health and Wealth Power Hour. Thank you for joining us today. We have a new deadline coming up, ladies and gentlemen. OSHA has announced that the requirement for workers at businesses with 100-plus employees to get the vaccine, I use that term very loosely, vaccine, is January 4th of 2022. Boy, I'll tell you what, it's going to hit the fan before then, I can tell you right now. There's a lot of unhappiness across the country right now with this. And I'll tell you one of the most telling signs of people being unhappy about this is that quite a number of them, from everything that has been reported, the majority of the people that are unhappy with this mandate seem to have been vaccinated, have already received the shot, one of the three that we have here in the United States. Very interesting, because they realize it is not about preventing COVID. It is about your rights and the fact that government should not be involved in this. CMS is also, CMS is the Center for Medicaid and Medicare Services. They're making all of the people that are involved with anything Medicaid and Medicare, whether it's the government themselves, whether they work for those organizations, or any participating healthcare organization that deals with them, which includes, of course, all of the major health insurance companies and many health insurance companies you've never heard of, they also must be vaccinated against COVID-19. Man, this is just a huge government overreach. I don't get it. I don't understand how we got here. I really don't. It boggles my mind that we have got to the point where things such as this are being mandated by our government, and then being told to private businesses that they must do this. That you're going to be fined every week that you don't have your people tested or have them vaccinated, and that these businesses are going along with it. Very, very strange time to be alive, ladies and gentlemen. Very strange time to be alive. As I had mentioned earlier, what is going to happen with health insurance and with life insurance and even long-term care and all of these other things that revolve around your health? How are they going to look at this? How are they going to look at people that have had a vaccine or have not? Well, I think that these type things, what you're seeing right here from the government, I think this is a clear indicator that they're going to also choose to issue a policy or not issue a policy based on your status as vaccinated or unvaccinated. I don't think that's going to happen right away, but I do believe it's going to happen. The fact that they always use the science on this, but then refuse to also use the science on it, because they do not take into consideration at all someone that has had COVID and what their immunity may be, which, once again, makes no sense to me. I don't claim to be a doctor, but I do understand that once you've had something like this, that you do have some natural immunity, but they disregard that. Of course, before the vaccines were ever released, that was a big deal. They talked quite a bit about that. And they had the the test that they used for people to check and see what the antibodies were. In fact, they wanted you to come in and give blood if you had COVID so that you had those antibodies so that they could help other people with that. Of course, then once the vaccine came along, they kind of forgot all about that and wants everyone to get a jab instead. Interesting situation. The big movement that I am a part of to help people get access to true health care instead of just doing what the insurance company says you have to do or allows you to do, or having that insurance company tell you got to wait 6 months to have a MRI or whatever it is that you may need to have. I've heard, of course, much worse stories of months and months of waiting to have a hip replacement and a knee replacement, just different things. It's amazing how they dictate that. But to get away from that so that you have true access, that is where we're going. Direct primary care, surgery centers that work with cash pricing, direct contracting with surgery centers, direct contracting with doctors, direct contracting with ambulatory centers, direct contracting with ERs, urgent cares. That's the direction we're going. That's what we're after. That's our end game, to get the insurance companies out of it, because what you're going to see is, as Emily mentioned when she called in earlier, you're going to have better access, and there's the potential to save millions and millions of dollars a year when you look at the way that they set up their pricing through insurance companies and what they allow hospitals to charge them 10 times the amount of Medicare or 10 times, 20 times the amount of what the actual service would be. It makes no sense. When we had Dr. Keith Smith on from the Oklahoma Surgery Center here a few weeks ago, he talked about every one of these procedures. You know exactly what the cost is going to be. You already know. You've done it so many times, you know exactly what it is. So why can't you tell me what it is? Why is it so many different costs depending on what insurance that you have? That's not right. It's time to step away from that, and it's time to get a better plan in place and to become part of the movement. Now, whether you're ready for that or whether you still need help with an ACA plan, we can certainly help you. We're not going to look down our nose at you. We're not going to say, are you sure you want to do that? No, we're going to help you find the very best thing that you can get. So don't hesitate to give us a shout. Once again, 210, I'll try to give you my own phone number. No, I ain't going to do that. 512-559-4358. That's 512-559-4358. Or EagleCareHealth.com. That's EagleCareHealth.com. We are very blessed that we will be leaving to head to Maui tomorrow. We are going to work with a bunch of folks over at a credit union conference over there, and we will be live from Maui next Thursday. And I hope you guys can join us then. We are going to talk a lot about how credit unions are really going to help us with this move. They understand how health shares work because credit unions work very much the same way. Appreciate everyone joining in today. Hope you got something out of it. Look forward to seeing you next week. Harlon Pickett, Health and Wealth Power Hour. We're out.
Thanks for tuning in to today's edition of the Health and Wealth Power Hour with Harlon Pickett. And don't forget to tune in each Thursday at 1 p.m. to find ways to access and keep more gold for your golden years. Because what it's all about is really enjoying those years and never running out of money on the Health and Wealth Power Hour right here on AM 700 KSEV.